Hi everyone, welcome to the channel where we discuss medical videos and lifestyle. Today's going to be an interesting video because it's quite the hot topic. So in today's video, we will discuss what Ozempic is, how it works, its benefits, its potential side effects, precautions, and other important information around it. It's gained a lot of traction in the news lately, and I felt it important to make a video about it at this time as there's so much information going on about it. The whole point of Ozempic being is that there's an argument that it helps with managing weight, be it just an isolated thing about weight or for managing weight in people with other issues such as type 2 diabetes. Weight is an increasingly bigger and bigger problem these days. I mean, in England alone, for example, where I am, 28% of adults are obese, 36% are overweight. So there's going to be more and more talk about it, and it's an issue. Let's get into the video. So let's first talk about what Ozempic actually is. Ozempic is a brand name for a medication called semaglutide. Over here in the UK, you may have also heard something called Wegovy, which is also a medication that's being marketed. Semaglutide is basically it's found in diabetes medicine, which is actually called Ozempic. So that's what Ozempic is. But unlike Ozempic, which is intended for those with type 2 diabetes, Wegovy is recommended specifically for weight loss. If you want a little bit more information, background of where the medication actually was produced, it's from a pharmaceutical company called Novo Nordisk, which makes both Ozempic and Wegovy. And they strictly advise that the product should only be used as recommended by a doctor. And what it is basically a once weekly injectable medication that you inject into the skin. It belongs to a class of drugs called GLP-1 receptor agonists. What GLP-1 is a hormone that is naturally produced in the body to regulate insulin secretion, glucose levels, and our appetite. So basically, Ozempic mimics the effects of GLP-1 and helps regulate blood sugar levels by stimulating insulin secretion when glucose levels are high and reducing it when they're low. It also slows down the emptying of the stomach, which reduces appetite and helps with weight loss as well. Like I said, it's gained a lot of media attention with many famous people reportedly using it, and it's thus allegedly developed quite the craze in Hollywood, beyond. So as you can see, it's been mentioned even by the Oscars just a few days ago. So there's a lot of talk about it. An article published last year, I think it was, suggested that the diabetes medicine Ozempic, which contains semaglutide, is being used by some professionals in the film and entertainment industry to lose weight quickly, right? So there's a lot of chat about it, and this is why we're talking about it. So how does Ozempic work? So like I mentioned, Ozempic works by activating GLP-1 receptors in the body. These then help regulate blood sugar levels. So that's what it does. When glucose levels are high, Ozempic stimulates the pancreas to release insulin, which helps lower blood sugar levels. When the opposite happens, so when glucose levels are low, Ozempic reduces insulin secretion, preventing hypoglycemia or low blood sugar. Ozempic also slows down the emptying of the stomach, which reduces appetite and helps with weight loss. So this is how Ozempic works. Like I said, the drug works as an appetite suppressant, basically by mimicking a hormone called glucagon, like peptide 1. So that's what GLP-1 is. This intestinal hormone is then released after eating and typically makes people feel fuller. So this should help, in theory, reduce overall calorie intake. So that's the mechanism of action. All right, so now we defined what it is, what it does, and what it should be doing to our bodies. Now let's talk about who can actually take it. So there's a lot of chat about it, and we see celebrities taking it, things like that. But now it's who can actually take it. Based on evidence from clinical trials, the guidelines here in the United Kingdom state that semaglutide could help people reduce their weight by over 10% if it's implemented with nutrition and lifestyle changes. At the moment, it will be recommended for use by people with at least one weight-related health condition, and as well as those who have a body mass index, or BMI, which puts them near the top of the obese range. A quick note on BMI. So BMI is calculated by dividing an adult's weight in kilograms by the square of their height in meters. So those who are lower on the obese BMI range, meaning a BMI between 30 and 34.9, could also be offered the drug if they have a weight-related health condition. So those are the criteria. And what are these weight-related health conditions? So the guidelines here, at least in the United Kingdom, and probably similar elsewhere around the world, these are people who are pre-diabetic, who have type 2 diabetes, who have high blood pressure, heart disease, or obstructive sleep apnea. Once weekly injections of it will have to be prescribed by a specialist, and an individual will only be able to take the drug for a maximum of 2 years. Now, that's debatable because some might argue that once you stop taking the drug, then all the weight comes back and so on. But for the moment, those are the guidelines. All right, so now let's get into the benefits of Ozempic. So it has numerous benefits when it comes to managing type 2 diabetes. Firstly, it has shown to be significantly good at lowering HbA1c, which is a measure of average blood sugar levels over 3 months. So that's the way we tell how things are going in a diabetic. In clinical trials, Ozempic has been shown to lower HbA1c levels by up to 1.5%, which is quite a bit. I mean, I know it doesn't sound like a lot, but it's quite a bit. Secondly, Ozempic has been shown to promote weight loss, like we mentioned a few times already. In clinical trials, patients taking Ozempic lost an average of about 4 to 5% of their body weight, which again is a significant reduction. So some trials have shown up to 10% even, like I said earlier on, which is a big difference. And thirdly, Ozempic has a lower risk of hypoglycemia compared to other diabetes medications. So the whole point is to regulate your blood sugar levels with diabetic medication. And some medication can tip you too far into the other direction, meaning you get hypoglycemia or very low blood sugar levels. And Ozempic is quite good at kind of keeping that even balance, so you're not dipping too low or flying way too high. So we've talked about all the good things about Ozempic. Now let's get into some of the bad things. So potential side effects are always there, like all medication, right? Ozempic is no different. It can have potential side effects. The most common side effects include nausea, vomiting, and diarrhea. Also, due to the rapid weight loss that can happen with Ozempic, it can lead to the skin losing collagen and elastin. If this is happening in the face, right? I mean, we call this something called Ozempic face. So it can happen, basically, saggy skin in simpler terms. And in rare situations, it can cause pancreatitis and kidney problems. So that's something to look out for. And basically, if any of these symptoms are persisting or becoming severe, it's very important that you speak to your doctor, who originally should have prescribed it anyways. And that's basically it. So overall, it's just important to speak to your doctor about the risks and the benefits. So overall, I mean, when we're talking about taking new medication, any new medication, there are always precautions. So precautions when taking Ozempic. Before starting Ozempic, it's always important to inform your doctor of any medical conditions you may have, right? So there are things like allergies to medications that can happen. So it's important always to chat to your doctor. It's also important to inform your doctor of any other medications you may be taking, including over-the-counter medications and supplements, because these can have interactions with the Ozempic that you may potentially take. And it's good to keep an eye out for these things. Some medications can interact with Ozempic and affect its effectiveness or even increase the risk of side effects. That's the whole point behind it. If you're planning to take Ozempic whilst you're pregnant or breastfeeding, absolutely you need to speak to a doctor because you might not even be able to take it. You always have to weigh up the pros and the cons. So overall, Ozempic, once weekly injectable medication, it's shown to be effectively at managing blood sugar levels in patients, especially with type 2 diabetes. It works by mimicking the effects of GLP-1 and reducing the appetite, which then helps to lose weight. Ozempic has numerous effects, including significant reduction in the HbA1c levels and lowers the risk of hypoglycemia. However, like all medication, like we just said, it has potential side effects. It should be discussed with a doctor always. Don't take it off the street. Don't buy it from your friend or anything like that. Before taking the Ozempic, it's important to speak to your doctor of any other medical conditions you have, any other medication you're taking. But overall, Ozempic is a promising medication for the management of weight and especially in addition to type 2 diabetes and other weight-related disorders. Thanks for watching the video. Like and subscribe for more. Leave a comment in the section below for other video topics you want us to cover, and we will see you in the next video.